I've been in Charleston now for 34 years, and I have a career as an educator. I love the outdoors. We live here in the country. I just like to be outside gardening and things like that. And then on the weekends, my husband and I have a really good time. We go boating, we love bike riding, we go to the beach, we love to walk the bridge here in Charleston, and just being outside with family and friends. In my family, we have a history of breast cancer. Of course, it was a very scary diagnosis for me in terms of having cancer. My mother passed away from cancer 18 years ago, and I have two sisters, my OBGYN, and I had some concerns about the recent mammogram results that I was receiving. So this new OBGYN suggested that I go see Dr. Barron for more precise studies, and fortunately I was in with him in time that was diagnosed with stage 1 IDC, which is invasive ductal carcinoma. He introduced me to the BioZorb, which is the device that he suggested I use in place of having a mastectomy. And so I wanted to make sure that this decision I made would be for the benefit of not only the treatment of it, but in the future. The value of having the BioZorb placed during the surgery was to help with the targeting of the radiation treatment, and it minimized the length of treatment. Instead of having 6 to 8 weeks of treatment, I only had 4 weeks, which is helpful in recovery. And then afterwards, there has been no negative effects. I didn't even know that it was in there. It provided markers for the radiologist to note every time I go to a mammogram or an MRI, but the device itself has been absorbed in my body, so there's been nothing that is no detriment to having that device inserted. Since the surgery and the healing for 2 years, there is absolutely no change in my breasts as far as the shape or contour. They're very, very similar to the way they were before the treatment and before the surgery. So I'm very pleased. Having breast cancer is a scary thing to go through. However, if you have the correct, or if you have a doctor and a team of physicians and nurses who are knowledgeable with the new technologies and the new techniques, it really is not as horrifying as it sounds, and I feel very lucky.